Imagine this. You are working your first shift in the emergency room. The atmosphere is tense, filled with the sounds of beeping monitors and hurried footsteps. A young boy is rushed in, struggling to breathe. His face is swelling rapidly, and his skin is turning a worrying shade of red. His mother is frantic, explaining he was just stung by a bee. She's terrified, her voice shaking as she recounts the incident. This, my friends, is a classic case of anaphylaxis, a situation that demands immediate attention and precise action. Anaphylaxis is not just an allergic reaction, it's a severe, potentially life-threatening allergic reaction. It can escalate within minutes. It occurs when the body's immune system overreacts to an allergen, a substance usually harmless to most. This overreaction can be triggered by foods, insect stings, medications, or even latex. This overreaction triggers a cascade of events, releasing chemicals like histamine that cause widespread inflammation and constriction of the airways. The body goes into a state of shock. Understanding anaphylaxis is not just textbook knowledge for nurses. It's about being prepared to act swiftly and decisively when every second counts. It's about having the presence of mind to administer epinephrine and provide supportive care. It's about recognizing the signs, knowing the protocols, and providing the best possible care for your patients. Every action you take can make the difference between life and death. Because in those critical moments, you are not just a nurse, you are a lifeline. Your skills, your knowledge, and your compassion are what stand between the patient and a potentially fatal outcome. Anaphylaxis can be triggered by a surprising variety of allergens. Some, like peanuts or bee stings, are well-known culprits, while others might be lurking in plain sight. Foods are among the most common triggers, especially for children. Peanuts, tree nuts like almonds and walnuts, shellfish, fish, milk, eggs, soy, and wheat are frequent offenders. These allergens can hide in unexpected places, making vigilance crucial. Medications are another significant cause of anaphylaxis. Penicillin and other antibiotics top the list, followed by non-steroidal anti-inflammatory drugs like ibuprofen and aspirin. Even some vaccines and biological therapies can trigger anaphylaxis in susceptible individuals. Insect stings, particularly from bees, wasps, hornets, and fire ants, are notorious for causing anaphylactic reactions. Latex, found in gloves, balloons, and some medical supplies, can also trigger anaphylaxis in sensitized individuals. Anaphylaxis doesn't always present the same way. It can range from mild, localized reactions to a full-blown medical emergency. Recognizing the symptoms early and understanding the potential for rapid escalation is crucial. Mild reactions might involve localized swelling at the site of exposure, itching, hives, or a mild rash. While these symptoms might seem less concerning, they can quickly progress. Moderate reactions often involve more widespread hives, swelling of the face, lips, or tongue, and gastrointestinal symptoms like nausea, vomiting, or diarrhea. Breathing difficulties, wheezing, or a tight feeling in the chest can also occur. Severe anaphylaxis is a life-threatening emergency. Symptoms include rapid swelling of the airways, leading to severe breathing difficulties, a drop in blood pressure, a weak and rapid pulse, dizziness, confusion, and loss of consciousness. Diagnosing anaphylaxis is often like putting together a puzzle. Each piece of information is crucial to form a complete picture of the patient's condition. There's no single test. Instead, it relies on a combination of clinical assessment, patient history, and sometimes allergy testing. This multifaceted approach ensures that no detail is overlooked. The first step is a thorough medical history. This involves asking detailed questions about the patient's past medical issues, family history, and any previous allergic reactions. Nurses play a crucial role in gathering information about the patient's symptoms, the timing of their onset, and any potential exposures to allergens. They meticulously document every detail to aid in diagnosis. This information helps to establish a timeline and identify potential triggers. Understanding the sequence of events can be key to pinpointing the cause of the reaction. A physical examination helps assess the severity of the reaction. This includes checking for signs of distress and evaluating the patient's overall physical condition. Vital signs, including blood pressure, pulse, and respiratory rate, provide crucial information about the patient's cardiovascular and respiratory status. These measurements can indicate how the body is coping with the allergic reaction. Skin examination for hives, swelling, or rashes helps confirm the allergic nature of the reaction. Visible symptoms on the skin are often the most telling signs of anaphylaxis. Allergy testing, while not always feasible during an acute reaction, can be helpful later to identify specific triggers. These tests are essential for long-term management and prevention. Skin prick tests and blood tests can measure the body's immune response to specific allergens. These tests provide valuable information that can guide future treatment and avoidance strategies. Prevention strategies for avoiding anaphylactic reactions. For individuals with known allergies, avoiding triggers is the most effective way to prevent anaphylaxis. This requires vigilance, education, and often a collaborative effort between healthcare providers, patients, and their families. For food allergies, this means meticulous label reading, avoiding cross-contamination during food preparation, and informing restaurants about allergies. Carrying 2 epinephrine auto-injectors, or EpiPens, at all times is crucial, as is knowing how and when to use them. For medication allergies, patients should wear medical alert bracelets or necklaces and inform all healthcare providers about their allergies. Carrying an updated list of allergies and their severity can be life-saving. Insect sting allergies can be managed by wearing protective clothing outdoors, avoiding areas where stinging insects are common, and considering venom immunotherapy, also known as allergy shots, to reduce sensitivity. Medical management of anaphylactic shock. Anaphylactic shock is a medical emergency requiring immediate intervention. The first few minutes are critical, and the nurse's role in recognizing the signs, activating the emergency response system, and initiating life-saving measures is paramount. The first step is always to ensure airway patency. If the patient is struggling to breathe, supplemental oxygen should be administered immediately. In severe cases, intubation may be necessary to secure the airway. Next, addressing the circulatory collapse is crucial. Epinephrine is the first-line treatment for anaphylaxis and should be administered intramuscularly into the outer thigh as soon as the diagnosis is suspected. Intravenous fluids are often necessary to support blood pressure and maintain circulation. Close monitoring of vital signs, cardiac rhythm, and oxygen saturation is essential. Combating anaphylaxis with medications. Epinephrine is the cornerstone of anaphylaxis treatment. It works by constricting blood vessels, relaxing airway muscles, and reducing the body's allergic response. Administering epinephrine promptly can be life-saving. Antihistamines like diphenhydramine or cetirizine block the effects of histamine, reducing itching, hives, and swelling. While they cannot reverse airway constriction or shock, they can help alleviate some symptoms. Corticosteroids such as prednisone or methylprednisolone work by reducing inflammation. They are often given intravenously in severe cases to dampen the body's overall immune response. Intravenous fluids help to restore blood volume and support blood pressure. Normal saline or lactated Ringer's solution is typically used. Patient education for anaphylaxis management. Beyond the immediate crisis, nurses play a critical role in educating patients and their families about anaphylaxis management and prevention. This education is not just a one-time event, but an ongoing process that ensures patients and their families are well prepared for any situation. This includes teaching them to recognize the early signs of a reaction, such as hives, swelling, and difficulty breathing, which can help in taking prompt action. How to administer epinephrine auto-injectors, which are crucial in stopping the progression of a severe allergic reaction, and when to seek emergency medical attention. Knowing when to call for help can make a significant difference in outcomes. Patients need clear and concise instructions on how to use their epinephrine auto-injectors. Demonstrations by healthcare professionals, practice injections using a trainer device, which can help patients become more comfortable and confident in using the device, and written instructions can improve adherence and reduce anxiety. These materials serve as a reference that patients can revisit whenever needed. Emphasize the importance of carrying 2 epinephrine auto-injectors at all times, as one may not be enough to control a severe reaction, as well as checking their expiration dates regularly. Discuss common triggers, avoidance strategies, and how to manage accidental exposures, and the importance of wearing medical alert identification. This can provide critical information to first responders in an emergency. Empowering patients to take an active role in managing their allergies can be life-saving. It involves building their confidence and ensuring they feel supported. It's about giving them the knowledge, skills, and confidence to navigate their condition and advocate for their health. This holistic approach can significantly improve their quality of life and safety. The importance of anaphylaxis education for nursing students. As future nurses, understanding anaphylaxis is not optional. It's an essential part of your toolkit. It's about being prepared to face a life-threatening emergency head-on, to be the calm in the storm, and to advocate for your patients when every second counts. This knowledge goes beyond textbooks and exams. It's about developing the critical thinking skills to assess situations quickly, to prioritize interventions, and to provide compassionate care to patients and their families during a stressful event. By understanding the causes, symptoms, treatments, and preventative measures for anaphylaxis, you are equipping yourselves to make a real difference in the lives of your patients. Well, that ends this video. If you found this video helpful, don't forget to leave a like, a comment, and subscribe for more nursing reviews.